MDS Conquer. Now I'm here to explain few important things that what we are going to do for the upcoming 1 month. Okay, I hope you know that the new things are going to start from February 21st. Okay, so from February 21st, our plan is to cover, first of all, we'll try to complete oral histology, which is going to be 7 marks according to the NEET blueprint, followed by planning to cover perio, which is going to be 14 marks. Next goes with general anatomy, which is going to cover 14 marks again. And last, planning to end with pharmacology, not completely, few areas of pharmacology. Basically my idea is to cover the dental part of pharmacology, and the blueprint says it's going to be 7 marks. Okay, so this is what our plan is, to cover 14 into 3 marks of 240 this month. Okay, so coming to the schedule. Okay, the schedule of MDS Conquer says for the first few days, as already discussed, we'll be covering the oral histology, which is going to be 7 marks out of 14, which combines with the dental histology. Okay, first 21st February, the first day, the plan is to cover histology of enamel and dentin, which is important and well known. The 2nd February, we are planning to cover development and growth of the teeth. This is development of the teeth, which is well known. 23rd is given as a revision day for you, and 24th, the stuff is overloaded again. We are going to cover pulp, we are going to cover cementum, we are going to cover PDL. Okay, so out of this, the cementum and PDL are again a part of your perio also, as the perio is also included in this week. So cementum and PDL will be a part of perio, so you need to cover this from 2 aspects. So next comes is 25th February. So you need to cover bone is again a part of perio. You need to cover TMJ, you need to cover maxillary sinus. Bone is a part of perio, that is alveolar bone, whereas TMJ and maxillary sinus are going to be part of your general anatomy also. You need to learn each and every aspect related to the anatomy of the TMJ, both bony aspects as well as the muscle aspect. Coming to maxillary sinus, all the boundaries and everything related to maxillary sinus has to be covered from all aspects, including the histology as well as from the anatomy point of view. So 26th February, we are going to cover salivary glands histology along with the salivary glands anatomy also. What are the different types of glands, major glands, minor glands, where are their anatomy is located, what are the associated nerves, and everything whatnot has to be covered from these aspects. Okay, the next comes is oral mucous membrane, which is again a part of your perio as well as your DH. Dental histology and perio will be covered from these aspects. So the next one is 27th. We're going to cover the tooth eruption histology, or the mechanism of eruption and everything. You're going to cover shedding of teeth. You're going to cover some histological stains as well as slides, because recently 2020 NEET has clearly proven that they can give question at any level, so we should not leave anything and has to be focused everything. Okay, so this is the plan of action for the first few days, where we are going to cover complete histology, that is dental histology, and a part of perio and a part of anatomy here and there in the most comprehensive way what we can. Okay, so the book of reference as already known. I mean, I don't want you to go with the textbook reading, okay, but you can keep the reference book as either Oddbunds, or you can keep 10 kids as a reference book, just a reference. I don't want anyone opening this book, reading full time, covering all the aspects. Okay, just try to be more smart, and all the individually, each topic, for example, enamel and dentin, how you need to do, where you need to do, in which sequence you have to do, will be discussed on the group. As most of you know that here the preparation will go in levels. Okay, preferably from level 1 to level 6, or few cases it may go from level 1 to level 5. Okay, so what you have to do in level 1, what you have to do in level 2, how the group is going to help you in level 3 and level 4, how the finishing and polishing of a particular subject should be done in level 5 and level 6 will be given on daily basis. Okay, so a daily basis voice note or a video based stuff will be posted, in which particular topic has to be done from which part. The level 1 has to be done from which area, level 2 has to be done from which area, and 3, 4, 5, 6 will be done from which area, will be clearly explained by you, by the respective mentor. You don't need to worry about that. So once we are done with that, so next level is 28th February. Okay, so the plan is to start with the basics of perio, that is defense mechanism. Again, the defense mechanism of the gingiva and host response. So a part of this will be covered in your microbiology immunity. Okay, so try to be more focused, try to cover as much as you can. And 29th February, so we are planning to cover calculus, gingivitis. All these are very, very easy things which you are more familiar with in your final year and in your internship. So we're going to cover calculus, gingivitis. I hope you remember the gingival enlargements. Okay, you have your gingival enlargements. You will be covering that. You will have your acute gingival infections like anag, hepatogingivostomatitis. Everything will be covered on this day. 1st March, a short video will be on your microbiology of perio will be covered. And the 2nd March, the plan is to cover again the easy aspects, that is the periodontal pockets, pattern of bone loss, next comes is the trauma from occlusion. Everything will be covered. 3rd March, you can cover different types of periodontitis. We'll cover diagnosis and prognosis and the treatment plan. 4th, the plan is to cover the instruments that are used in the perio and the plaque control measurements. From 5th, we'll be more dealing with the surgical aspects of perio. The 5th, you're going to cover gingivectomy and curettage. 6th, we'll be covering the flaps and mucogingival surgeries. 7th, we'll be talking about the treatment of furcations, different types of furcations, different grades of furcations, and the treatments. And we'll be focusing on osseous surgeries, the grafts and everything whatnot. 8th March, a day of revision. All your backlogs which are left over due to any other issues will be covered. So we are done with perio. So perio, the reference book, as you know, you can go with Carranza as a chance, not to cover each and every aspect, but what to be done, where to be done will be clearly given as a hint and will be guided by the group. Don't worry about that. Okay, so the next 9th, we need to start anatomy as fast as possible, and the toughest one is brain. So we are going to start anatomy of brain first. which is regularly, the brain will be regularly avoided by most of the people, but it is important in examination point of view. So next one is 10th is osteology. Osteology is more of diagrams, more of foramens, order of foramens, which nerves, which arteries, which vessels, which things will go in each foramen, identification of this foramen, and all those things will be discussed with diagrams in the video based class. So 11th March will be covering anatomy of thyroid gland, mouth, pharynx. 12th March will be covering larynx, will be covering tongue, development of tongue and everything whatnot. So the toughest day for you is going to be 13th March. That is going to be your vascular supply of head and neck. Okay, followed by 14th March, you're going to cover the muscle supply of head and neck. And if possible, we'll cover the nerve supply too of head and neck. So all nerves, muscles, and arteries, veins related to head and neck are very important in examination point of view. 15th March is left as a day of revision. So according to the NEET syllabus, even the ear as well as eye are a part of the syllabus. Okay, but most of the books, most of the people, they neglect this, but I'm not in a position to take any sort of chance in neglecting any topic which a question can come from. So eye and ear will be covered in specific on 16th on the group. 17th March is more often my target is to focus on the clinical anatomy, or it can be called as applied anatomy, which is a very specific topic. Okay, so most of these topics will be neglected by most of the mentors, but we don't want to take any sort of chance in the examination hall, so will be covered from all the directions. Okay, so days are 18th. According to the blueprint, our plan is to cover chemotherapy part 1. I'll be discussing what part 1 will include. 19th March will be chemotherapy part 2. 21st will be the revision days, and 22nd March is the exam on dental histology, your part of pharmacology, your perio, and your general anatomy. So these two are going to carry 160 marks. So pharma is going to carry 40 and H is going to carry 40. So this is going to be 240 marks exam for you. So get prepared for that. So how smart you have to be. So the group, what group is going to do the smart work for you is, so all your chemotherapies, for example, if I take, you can keep anatomy, you can keep a reference book, reference for anatomy as Chaurasia, whereas the reference for the pharmacology for now is KD Tripathi. Okay. So what smart thing you can do, for example, chemotherapy part 1 and part 2 will contain topics like antimicrobial drugs, that include antibacterial, antiviral, antifungal, and anti-cancer drugs. A few areas of anti-protozoal drugs will also be covered, mostly focusing on your malaria, your Taenia solium, and your Entamoeba histolytica. Okay, so what group is going to do is, group every 3 days we are going to release a video. Okay, one video for first 2 days, one video will be on penicillins, the second video will be on tetracyclines, third video will be on cephalosporins, fourth video will be on macrolides, fifth video will be on aminoglycosides. So every day you don't need to do the core work from your side. The group is going to provide you a video of 10 to 15 minutes covering all important and major things to be focused on a particular classification. Similarly, antiviral also, antiretroviral, okay, all these things will be covered. Antifungal also, okay. Similarly, every aspect, every classification will be trying to cover from our side, so that can be revised in 18th and 19th. Means the pharmacology will have an incremental reading. So apart from the regular schedule, this is a schedule that is prepared by 5 or 6 mentors together sitting. But what my ideology, my suggestion for you is, we'll do pharmacology in incremental way. Means every 2 or 3 days of this 30 days plan, every 2 or 3 days we'll be posting one classification, one small video related to that. So we'll have 10 videos on pharmacology, where the major stuff related to the chemotherapy part 1 and part 2 will be covered in prayer. Means you can keep all these 5 days for revision, because we'll be covering all these incrementally every day. So what are exclusive things that you have to do is try to be more focused, try to follow the instructions that are given by the mentors on the group, and try to be on time for everything. Okay, so that's what the plan of action for the upcoming 30 or 32 days. Okay, so try to use the things at your best. Okay, both the video based discussions as well as the regular normal mode of discussions and the notes is exchanged on the group, and the regular examinations, whatever the examinations that is being posted on the group, please try to do everything